Hi, it's Jenny B, NSWOC, and today we're going to continue on with our pain in the butt series and talk about perianal abscesses. Now, this isn't something I can probably show you any photos to because, again, we're talking about anywhere around the anus or in the perineum. So these are kind of sensitive areas that, again, is really literally a pain in the butt. So what happens is there's often a small ingrown hair, or due to sometimes pressure. I actually often see this with people that are road bikers and they do long distance biking that are sitting for long periods of time, you know, and there's pressure in the area, or again, just you've been very unlucky and you end up with something that feels like a pimple in somewhere in the nether region. Often these first form a small nodule or a really hardened area, and they can be red and they can be actually quite painful. Most of the time, patients actually present to the emergency department with this, and they're like, you know, I literally have a pain in my butt. And what's happened is, again, there's usually some small infection that's happened in the hair follicle that's caused this to erupt. Now, it's great if this only happens once. We're actually always really rooting for a patient that, you know, this was just a one-off, something, you know, a bad occurrence that's occurred, because there are actually quite a few chronic conditions that if this reoccurs, I would say more than 3 times, that we then really start to investigate, is there other causes? Now, the first thing with an IND is where we're actually going to do irrigation and drainage. That's usually the primary treatment for it. Now, as again, working with surgeons, we do know that, you know, any abscess, as soon as we open it, that abscess is now finally drained. And we really don't have to provide antibiotics because that infection has been released. So it's another big piece that often, you know, there's antibiotics thrown at it, and it's really not the solution. The solution is to actually open it. So one of the first things we'd like to do after we open it, and sometimes it may not happen in the emergency department, it may happen in a wound clinic, is we're actually going to probe it. So I have this little probe that we use. We have, there's 2 types. So there's ones that nurses can use because we do have these lovely little sticks, so the little plastic long 6-inch Q-tips. Or again, I have these metal ones that we use. We like these because you can see there's a bit of a curve in this one. We can bend them. We can bend them quite easily through the track and actually find if there is a track that's happening as well with these abscesses. Often it's just a small little cavity. We're super happy if that's the case. But when there's tracks, there's a risk of fistulation. Again, that's another piece that I'll talk about when we go into the chronic aspects of this. Now, the other big question is, do we pack or not pack? I often just say it really depends on patient tolerance, because if they're not tolerating you packing, again, we can just allow them to close. Yes, there is a risk for it to close over and then reform, and that it has to be opened again. But again, if they're really not tolerating it, it's really not beneficial to them. Again, there is studies that show that packing, you know, not packing something sometimes is not statistically significant. However, wounds can actually heal a couple days sooner when we don't pack. So really, when we are packing, the goal is that we're actually trying to get the fluid that's in the base of the wound out so that there's no longer any infection that's remaining. So it can be an important piece to the actual treatment plan, but again, it doesn't always have to be. So as long as they're cleaning the area, doing sitz baths, you can actually buy these little plastic pieces that sit right in your toilet so that they can sit down, keep that area super clean. That can often be just as sufficient as trying to pack this wound. So again, it's not imperative that we pack these wounds. What's really imperative is that they stay really clean. Now, if it is in an area that's very hairy, we also do often recommend hair removal. Sometimes even after the fact, we'll recommend like a laser hair removal so that this doesn't continue to reoccur. However, the hair removal, you know, using a razor and whatnot can also be helpful depending on the size of these. So for the most part with the perianal abscess, they're going to go through an irrigation and drainage where they just get a little stab wound, open that up, allow the drainage to come out, and then again, sometimes I recommended packing, which again may or may not be beneficial, really based on the patient's tolerance. Again, and then we also start to look at reoccurrence. How many times has this reoccurred? Has it reoccurred in the same area, or is it very localized to one specific area? And again, there are different types, like a Bartholian cysts, there's different types that can come up depending really on the location in the region. A little different than the pilonidal. If they're up high, again, they're in that coccyx natal cleft area. It's a different type. So again, for the most part, we're really hoping we can just drain these. Sometimes pack them. Make sure that they're doing sitz bath and cleaning them. Again, if you're packing them, the sitz bath would be done prior to doing that. And then again, hopefully it's a one-off for them. But again, I will do another video. So what happens when the cyst has turned to long-term, or they've continued to reoccur, because then there's some other options that we have to look at. So that's it for today. Hopefully that helps with the perianal abscess. And again, just remember, the best wound is a closed one.